So I wanted to bring you on Real Talk with Ronnie, because this is something that's kind of front of mind, being that I'm pregnant again.
Yes.
But also I've had tons of friends who have suffered, and I've realized, like, before I ever got pregnant, I didn't know that people had these issues, these pelvic floor problems.
Yeah.
And then also I didn't know that, like, it was A, so common, but B, there was like specialized doctors that exist for this. You know, and that's just bringing awareness to it, I think, is so important, because it's like one of the uncomfortable postpartum things nobody really wants to talk about.
Yeah.
However, it's like so important because...
So important, yeah. It's like shocking that people don't talk about it more, but you know, I think it's good that we are, you know, now we're spreading more awareness. People are talking about it more. Yeah, so I think it's great. You know, obviously I think social media and internet has a lot to do with people like researching and talking about these things. So,
so what is
really
your
great.
title? Like, what did you study and what, like...
Yeah. So I'm a board certified physical medicine and rehabilitation doctor. So also known as a physiatrist or like a rehabilitation doctor.
Right.
Basically we focus on like the diagnosis, treatment, and then rehabilitation of diagnosis with pain or impairments. And we focus a lot on function and how we can achieve, you know, people to go back to their activities of daily living without pain, or how we can help them in that way. So it's a really broad field. Could be like very like, you know, neurologically based, like in stroke or traumatic brain injuries, all the way to like sports medicine, where you're focusing more on, you know, injuries of the shoulder, things like that. And so I specialize in pelvic pain, pelvic floor dysfunction in males and females.
Okay.
Yeah.
And so today we're specifically going to talk about like the postpartum experience.
Yeah.
What do you commonly see in postpartum patients? What happens? And what is like the most common, I guess, things that you treat?
Yeah. So, you know, the pelvic region is so complex, you know, so there's, for females, we have our uterus, vagina, and then there's your bladder, your urethra, your colon, and your rectum, and they're all so close to each other. So for postpartum, after going through delivery, you know, you can have symptoms with all of those organ systems, really. So we can see really a wide variety of symptoms, but really common is urinary symptoms. You know, I think this is the one most people talk about. Incontinence, when, you know, leaking of urine when you cough or sneeze or dance. But some patients, but some patients even have like urinary urgency or frequency or like a sensation of a UTI. But, you know, they do all the cultures and there's no, you know, there's no actual infection. So that can be one thing. Another common symptom is painful intercourse. So, you know, postpartum, after you see your OB, they said, okay, you know, you're cleared, you can have intercourse. And a lot of patients experience pain with, it could be superficial pain, just with entrance or deep penetration or certain positions that they weren't experiencing, you know, prior to being pregnant.
Let's be clear. We're not talking about the first time after postpartum, because I feel like
right. It's like going on and
everyone.
On, right?
Yeah. Right. So to be clear, that is supposed to hurt and usually does, because it just does.
It's been a while. So,
but then but yeah,
after a couple of months, it should not hurt, right? And it shouldn't hurt ever, really, for anyone. Right. But yes. So yeah, that's very common, you know, and sometimes, you know, you may think, okay, and it does get better, you know, but sometimes if it doesn't, then that's like, you know, why isn't it getting better? That's something to think about. Another symptom could be like sitting pain, where, you know, you have a lot of pain with prolonged sitting, or like tailbone pain. Yeah. I just had someone who came in, had her third child, and she came in like right away, because she's like, this always happens to me after I'm pregnant, and I need to do pelvic floor PT or else I can't sit, I can't work. She's like, it's just really difficult.
Right.
So that's very common as well. A lot of, straining, constipation can occur as well. So really, like, there's so many symptoms you can present with, and sometimes you don't know, like, okay, maybe I'm just constipated, but, it may be related to your pelvic floor, actually. So it's always something I think people should consider when they're, having these symptoms.
I think, at least for myself, there's so much that happens to your body after. You don't know what's supposed to be happening, what's normal, what's not normal, and you just kind of, at least I shrug it off to being like, well, I had a baby, so this is
right. And initially that is, that's true. You just underwent, like, your body went through like a trauma, in a sense, not in a negative connotation, but it's a huge transition.
Yes.
And depending on and depending on like your labor, let's say you had prolonged labor, you had to have an episiotomy, or they had to use a vacuum or things like that, that can all really like affect how, you heal. And so it's, if you're still having pain 3 months later, that's not, we normalize it, but it's not normal.
That's
like you said,
flag.
You think like, oh yeah, I had a baby, so this is just how it is, but it shouldn't be.
Okay. So that's important to know. Like, we shouldn't just say like, it's supposed to be like this. Like, you should definitely go and get checked out and get a medical opinion. Because like almost with everything, I'm just like, oh, okay, like this is now the new way that because I had a baby, but like that's probably not the right way to go. And I feel like, is it the case that the longer you go without treatment or some sort of physical therapy, like the worse it could get?
It's just, then you end up in this kind of chronic cycle of discomfort and dysfunction, and then it becomes more difficult to treat. As with anything, like, you sprain your ankle. If you don't address it soon, it's not going to get better soon. And so this is just, the quicker you address it, the quicker we can really make you feel better. And so that's why it's important, like if you are, after you're cleared from the OB and, if you're still having these symptoms, I would say 3 months, then it's really something you should address.
Right. And so the good news is that there are exercises and treatments and therapies that exist that have proven to help women somewhat heal from these problems.
Yeah, definitely. I mean, there's a lot of, treatment options out there, and everyone's case is different because everyone goes through something different. But it's important to get evaluated, I think, just so you know what's going on, whether that be with a like pelvic floor PT, or if you want to see like a physiatrist, so you know what's happening. So it's really when you see us for an evaluation, our treatment plan is always like multimodal. There's always different things that we recommend. So pelvic floor PT is always, I send 100% of my patients to pelvic floor PT. It's not just to help you get better, it's to educate you too, to know what's going on with your body, where these symptoms are coming from, what's going on, and then make you, feel empowered and be able to, manage these symptoms on your own if you were to experience them later, so you know what's going on. Obviously, there, some patients require medications. So sometimes because the muscles in the pelvic floor become really tight and spastic, and we can treat that with like a muscle relaxant in a suppository form. So less side effects systemically. Sometimes, some patients do need oral medications for those pain symptoms that kind of persist, especially like I said, when the symptoms go on for longer, you end up in this kind of pain cycle. So sometimes we do have to do oral medications. And then for some patients, who have been going through this for a long time, for years, we do also provide like injections. We do an injection series where we do external ultrasound guided nerve blocks and trigger point injections to address the pelvic floor, from a neuromuscular way. It's actually a very, kind of simple procedure. You come in, you can go about your day right after, but we're really trying to just improve that environment, increase blood circulation, try to reset those really tight muscles, and the patients are usually undergoing pelvic floor PT at the same time. So hand in hand, those work really well together. So there's so many options, and we can try one and then keep going when we need to. And I think another thing that's so important in, any pain patient is like cognitive behavioral therapy, because it's not just one thing, this pain is like biopsychosocial. So it's really important to address it from that way too, because it can affect your mood, it can affect how you interact socially, how you interact with your partner. If you're having pain with intercourse and now you're not having intercourse, that can affect your relationship. So it's something that, it affects a lot of parts of your life, really. So
it's so interesting.
There's a lot of things you can do.
Such a big, important part of your body. But it's so easily ignored because, like, if you break your arm, it's no brainer. You go to the doctor and he fixes your arm or puts it in a cast, and you take medication, and then you go to PT and you do this and you do that. It's like, why doesn't that automatically happen after you deliver a child?
I know.
So this region, it's silly to think that it's not kind of part of the postpartum process almost, and normal as, like, these are things that happen, I would say, more common in other countries, which I learned from you, that, women, it's a part of the postpartum process, and it's like built into their culture that, okay, after you have a baby, you go to pelvic PT, and this is what you do, and it's part of your postpartum process, and it's part of your, of how you heal and get back to normal after delivering a child, which, like, I never knew that existed, number one. And number two, why doesn't it exist here?
I know. It's, I know, it's pretty shocking. Yeah. In Europe, like, a lot of our European patients are like, well, I'm here, I'm here. My doctor cleared me at 8 weeks, so I'm here. And for them, it's just standard. And for us, that's why we're just trying to bring more awareness to this topic. It's very, kind of taboo, or, there's a lot of lack of information and misinformation. And so, in France, every patient postpartum gets, I think, a physical therapy script and a pelvic floor physical therapy script. So to kind of just work on everything. And, I think that in itself also brings about a conversation, because you're now making the patient aware that this is a resource. Right. And let's say they don't go right away, but now they can think about it later, like, oh, I'm still having these symptoms. Maybe I should do that, instead of being like, oh, I guess this is just normal. Let me just wait a little bit long, see how that goes. So it's definitely interesting that it's not, you would think that it would be more talked about, but it's really just unfortunately not. But I think, that's why we're talking about it, so that I hope that people know that it's available to them and they're not suffering in silence.
You're somebody, you're friends with, we're a friend of friends, and like, I had no idea, and if you never got this job, I would have never known that like this exists, and that you can do this, and that it's normal in other places. I clearly was aware that people have issues afterwards. Like, I myself have pain in my tailbone when I sit long, or like, I'm always sitting on some sort of
Yeah, you got a Pharisee. Great.
some sort of like padding. Otherwise, it's very uncomfortable for me. And it only got worse when I got pregnant again. And my doctor was like, well, all your muscles are now relaxed. You have a lot of progesterone and hormones going through you. And so it makes sense it'll hurt more. But I just lived with it for 3 years after I delivered my first daughter. And I was like, okay, like that was like, I pushed for 2 hours. My body probably hated what was going on. And so it hurt. And I probably injured my tailbone. But like, this is now my life. And I never spoke to a medical professional about it until I spoke to you. And I'm like, this is, maybe there's things that you can do, or maybe, you know, like you can be proactive.
Yeah, there's so much. Yeah. And it's like, you know, 3 years in pain, that's just like unnecessary, you know?
And it wasn't, you know, so bad that I ever had to take medication, but it's definitely uncomfortable. Yeah. I mean, there's definitely, you know, it definitely affected my life. Like I can't sit for too long. I can't stand for too long. I can't walk for too long. Like it's bothersome.
Right.
So yeah, I mean, I think it's great that we're talking about it. I think it's great that facilities like the one you work at exist. I think it's like super important. Like a lot of people talk about what happens with your abs or what could happen. And like that's a common thing that we hear about. And now there's a lot of physical trainers who are now getting certified to help with specific exercises for women in that space. Yeah. But nobody's talking about the pelvic floor in the same way, and it's equally, if not more important.
Yeah, it's so important. Yeah. And especially like what you were saying, so that separation of the abs, it's like called diastasis recti, right? And so separation and then postpartum, you know, your abs there's a gap in between them. And really you do need physical therapy after if it does occur to you. And so, and if that happens, now you can imagine now your pelvic floor also is like working harder because those core muscles are not strong. And so, yeah, I mean, I think that's another thing that, you know, commonly people do talk about. Okay, yeah, I have that separation. Some people call it like the mommy's pooch or something like that, you know? So again, it's like something like that people talk about because it's a little bit, you know, they normalize that as being okay. But I think talking about the pelvis is a little bit more private. So people just, you know, avoid that conversation. Yeah.
Yeah. And also it's like an aesthetic thing, right? Like we're so focused on getting our bellies back to pre-baby, right? Because it's affected somewhat the most in terms of what it looks like. Right. And so everyone is laser focused on like getting your belly back to whatever you want it to be. Right. And so, you know, if you have to exercise to do that, which most people do, then like all of a sudden it's front of mind. Oh, I can't do this because I will injure myself. But your pelvic floor does most of the work and has to automatically just go back to being perfect and normal. And it's just, you know, that's an unrealistic expectation, I think. Yeah.
It's definitely, not considered, I think, enough. And even with these symptoms, you know, sometimes we kind of, think about them in one way, like, oh, okay, I just leak with urine. It must just be that, you know, but there's something else that's causing that. There are other things that are going on. And so, you know, really looking at the whole picture together will give you the best chance of kind of addressing it to make it better, you know?
Yeah. So we need to lobby for our politicians to make this part of our postpartum recovery. Like it should be included. You go to your OB for your 6-week checkup, and then you go to your pelvic floor specialist and talk about what's going on. Like it's got to be like scheduled in, right? Like we take the baby to the pediatrician on day 3 after the baby's born. Nobody questions it. You just do it. It's got to be one of those things.
Yeah, it's like, you know how they say it's like the 4th trimester. It's like part of that. It should be like, that is like one of the things on the, you know, your checkbox. Like, what am I doing? Okay, I'm doing these things, and I'm going to, you know, see someone about my pelvic floor. It's just, it needs, it needs to be assessed, I think. And, this way, what's going on.
It's funny that like OBs don't even mention it, that these people exist, or that if you need this resource, here it is. But
yeah, I think it's such a like growing.
Don't say anything.
I know. It's like a growing field. I think now it's just becoming more, like people are becoming more aware of it. And so, but I think patients should always advocate for themselves, like, hey, this is happening to me. Who do I see? Do I see you? Is there someone else who can help me with this? Because you don't want to be going through it for too long, or else you kind of go, you're in that pain cycle, that, cycle of dysfunction. Those muscles are just getting tighter. And so it's always good to address it earlier on, and be aware of it. So when it does happen, what you're looking at or what you're experiencing. And so, education is so important in this thing, but like you said, not many people talk about it. So
nobody talks about it.
Yeah.
I think that it's important for everyone to know that she's in your room, love, that this exists. And tell us about like you and your practice and where you guys are. If there's people in the tri-state area that want to reach out, like how do they get in touch? And are you like covered by insurance? Is this like a referral that you have to get to come and see you? How does it work?
Yeah, so I work for a practice called Pelvic Rehabilitation Medicine. We are located in New York City. We have one office in New Jersey, Long Island. They have some offices across the East Coast, and then we have some in Michigan, Chicago, Texas. You can go on www.pelvicrehabilitation.com to make an appointment. And you'll see all of our offices there. All of our physicians are physiatrists, just like me. And yeah, we do accept some insurances. And so that's something that we can, figure out once, you want to make an appointment with us. But yeah, and we work with a lot of the pelvic floor PTs around. So it is, it's a great resource for patients. And so, yeah, I'm in the Englewood, New Jersey location. And we're opening up a location in July in Florham Park. So I'll be there as well. And so if you're in New Jersey, yeah, I'm around.
Oh, I forgot to ask one question. Do people women who have C-sections suffer from pelvic floor issues in the same way, or does it not apply to them because the baby came out in a different manner?
Yeah, I mean, sometimes they can, have pelvic floor dysfunction, but a lot of times we see more anterior pain because of the incision. Sometimes the nerves are affected there, so they may have different symptoms, but definitely, pelvic floor PT is someone that can still work on that scar tissue mobilization and working on that area. It's, I think, just as important for patients who have C-sections.
Interesting.
Yeah.
So it really runs the gamut of all people who go through delivering a child, regardless of how you do it.
You're carrying a child. Your pelvis is really, the main muscle on the bottom holding all of your organ systems up, and when you're pregnant, that baby as well. So
yeah. Well, this was very, very helpful.
Yeah.
You are a star, Rakhi.
Oh my gosh.
I didn't even know this.
You're a star, Ronnie.
And I just learned so much from you. And I say this to our friend in common, Monal, all the time. I'm like, can't you just deliver my baby, be her pediatrician, and just live next door to me? And she's like, no, it doesn't work that way. There are different doctors for different things.
Yeah.
But it's so great to have you as a resource in my network and as a friend.
Yes, definitely.
It's so nice. We knew each other when we were in college, and
I know.
look at how far we've come, and I would have never imagined talking to you about my pelvic floor. but I'm so happy I have you to do it, because it's so
no, definitely. It's a great conversation. Thanks so much for having me on. This was, I think, a really good conversation for people to hear.
Yeah, and I mean, the whole reason I started Real Talk with Ronnie was like to do stuff like this, to talk about real life, uncomfortable things that nobody else talks about, that kind of selfishly affect me, but also like I know affect other women.
So many,
And it's just nice to put it on the platform, bring awareness to it. Hopefully we help somebody else, you know, that might be in pain and didn't know that there's resources like you available. So yeah.
I know so many of our patients come to us like sometimes years after. And so it's, you know, it's really important, I think, to bring awareness, because when we're seeing someone who's suffering for so long and doesn't know where to go, it's, you know, it's very challenging for them too. So yes, there are, you know, so many resources out there. So, you know, search out.
And let's normalize it. Let's normalize making this a part of the fourth trimester. Let's normalize making, you know, going to get PT for these types of things, like just the standard. And maybe one day, like maybe my kids, it'll be normal and they'll go to a checkup.
That everyone will be doing it. Yeah, it'll just be part of the plan.
Hopefully.
Yeah.
We'll get there. Baby steps.
Yeah.
Well, thank you so much for coming on Real Talk with Ronnie, Dr. Rakhi.
Oh, thank you.
I'm going to tag your facility, and obviously if anybody's any questions, they can reach out to you directly. And obviously you can hear this conversation on the podcast, iTunes, Spotify, wherever you listen. Thank you.
Perfect. Thanks.